Hello everyone! Our second episode of Newborn Care, we will be sharing about what the baby is doing in their first 24 hours of life. Also, what are the types of injections need to be given to the newborn before we release them to go home. And of course, when parents have any doubts when their baby is not doing well, what should they do? Our pediatrician Dr. Ru Wei will be sharing his thoughts about the newborn baby.
So after the initial skin-to-skin contact, once the baby is ready, we will transfer him to our nursery. This is our nursery. And the first 24 hours of a baby's life basically is just drink, sleep, pee and poo. So while you will be resting in your room, the nurses here will be monitoring the baby for his passing urine, passing motion, and we will try to support you with breastfeeding. It's very important that the baby receive the breastfeeding as early as possible. And the first few days, the breast milk is called colostrum. It's very, very nutritious for the baby, and it's highly encouraged that you try breastfeeding. The first day in nursery, we will also provide some vaccinations for the baby. That includes the hepatitis B vaccine and also the BCG, and also another vitamin K. Vitamin K is important because babies upon delivery, they have the tendency of, without the vitamin K, they might bleed excessively. And this can lead to, in certain cases, bleeding into the brain. So it's standard that we will give a dose of vitamin K for all babies upon delivery. Once you are ready to go home, in cases of normal delivery, normally is the next day, and in a cesarean section it will be 2 days later. The baby, if there is no other issues, will go home together with you. Before going home, I would also check for a bilirubin level to make sure that the baby is not jaundiced, and at the same time I will do a full from head to toe examination to look for any kind of abnormalities or any signs that we need to worry about. And at the same time, we will do a hearing test as well to make sure that both hearing is passed, and then the baby has no issue with hearing. Baby care at home for the first month essentially is making sure that the baby is gaining weight, that the baby is getting enough milk, and at the same time for the first 1 to 2 weeks, you will have to make a few visits, probably 2 to 3 visits to our clinic to check the jaundice level. And whether if the jaundice level is too high, then they might be admitted for phototherapy. When do you need to consult a doctor? To me, it's pretty much whenever you have a concern. We are not here just to treat an illness. We are here to support your journey from the baby, the moment the baby is born, all the way until he or she may be 12 years old. So whenever you have any concern, having difficulty in feeding, having not sure whether the baby is peeing enough, some of the common questions would be whether if the baby suddenly have some noise when she is breathing or sneezing, anything. If you have a concern, you can always contact us, and we will do our best to help you.